we're gonna apply pre-wrap on the distal aspect of the shin area because we're gonna get this athlete ready to get his shins taped. So obviously we put pre-wrap on to protect the athlete's hairs, right? We don't wanna put tape directly on their skin. It'll cause them blisters and it'll cause them a lot of pain. So notice how I'm keeping the pre-wrap nice and snug as I move up towards the shin. So I'm giving it a little bit of tension, but I'm trying to keep the pre-wrap as close as I can to the body structure so that we don't get any wrinkles. So medial tibial stress syndrome is also known as shin splints, right? So usually shin splints occurs in all different athletes. It occurs in different areas, but most of the time it happens on the distal medial aspect. So usually in this area here, right? Because it's usually the soleus muscle or the gastrocnemius muscle that gets irritated. Okay, so we're gonna keep the pre-wrap on like this. Notice it doesn't have any wrinkles, and then we're gonna tape them for shin splints. We're gonna tape this athlete's shins because he has medial tibial stress syndrome. And notice that I'm applying the 1.5 inch athletic tape on the lateral aspect of the distal ankle. And I'm moving my way medially. And as I move my way medially, I'm also gonna apply pressure as I cut that tape. I'm gonna pull on that tape and I'm gonna apply it there, and I'm not gonna close it. The reason for that tension is because I'm moving the muscle towards the bone, right? Because it's already irritated. Then I'm gonna apply the second piece of tape, halfway the distance from the last one. And if you notice here, I'm also gonna put tension on the tape, and then I'm gonna cut the tape, okay? So as I move toward the proximal aspect of his shin, I'm applying the tape halfway the distance from the last one with tension on the medial aspect, right? Because we're trying to alleviate that shin pain that they're having, right? So once again, tension and cutting, okay? And I'm gonna keep that process up halfway the distance from the last one, all the way through. You cut the tape. I'm giving it tension, halfway the distance from the last one, tension, cut the tape. Still giving it a lot of tension, right? I'm pushing that muscle towards the bone. If you ever have pre-wrap trying to like bundle up on you like that, you can just take it off. Here you are, going halfway the distance from the last one. Once again, we're giving it tension, pushing that muscle towards the bone, okay? I'm almost done here, so, okay. Now, usually I ask the athlete if I covered their pain area. So their pain area is usually in this area here. So 9 times out of 10, they'll tell me, yes, miss, I don't have pain any further up. So I will stop there. And then I take just a piece of tape and I apply it, right? I just apply it on top like this so I can give the tape support, no tension on it at all. I'm just applying the tape, no tension. I'm trying to make sure that the tape can last the athlete. So let's say this is a soccer player. We want to make sure they can get through their soccer practice or their soccer game, right? I'm applying no tension. And that's what it should look like. Now we can also take some light plast, and notice the light plast has a little bit of elasticity in it. So we're gonna apply it. We're gonna pull on the light plast. We're not gonna give it too much tension, right? We're just trying to support this taping so that this light plast will provide the athlete more comfort and support. And at the same time, it absorbs sweat a lot better, right? So you can do continuous taping But you got to make sure you're not giving it too much tension, right? Because we don't want to give tension to the lower leg. We don't want to stop blood supply, right? So we cover the entire taping job with Lipoplast. And then I always like to check their pulse, right? You can check their tibial pulse, their dorsalis pedal pulse. You can also check capillary refill to make sure that the patient feels